Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper right first molar and the upper right left molar region. Now, in the first molar that you can see, we have an edentulous ridge. We've got very weak bone in this region, and we also have a upper right second molar, which seems to have a periodontic lesion all over it. Now, on the panoramic view, we can see that there is a vertical bone defect with a periapical radiolucency and bone loss associated with the upper right second molar. And we've got a gradually decreasing angular bony defect. Now, if we show you from an axial view, this is the upper right second molar. The upper right first molar is missing. As we are moving more apically here, we see that the upper right second molar has a huge bony defect from its mesial aspect, the area of the sixth, including the parietal root here as well. The distal root also has radiolucencies associated with it. As we move superiorly, we can see that there is an architectural form that is associated with the sixth. And if we will measure it on the transaxial view, and we will even place a implant so that an idea can be given on how a virtual tooth replacement can be done. As far as the upper right second molar is concerned, this tooth will definitely need to be extracted, and vertical and horizontal bone augmentation will definitely be needed in this case. Now, this is the transaxial view. The transaxial view is very similar to a proximal view. So I'm going to zoom in on the upper right side. On the transaxial view, if you're considering the center of the ridge, we've got approximately 9.6 millimeters of ridge width with approximately 12 millimeters of ridge height. Now, this and the bone quality in this region is D3, primarily because we've got very thin cortical plate and a very exorbitant amount of cancellous bone in this region. Now, as we move towards the distal aspect, we can see how the bone dips. This is where the bone dips. When we look at the second molar, we can clearly see that has very severe bone loss. The parietal root, the mesial root, the distal root, they're all associated with major periapical radiolucencies. And we don't have sinus perforation, we don't have sinusitis. This is normal mucosal thickening. So this tooth is completely hopeless. We will now move towards the upper left hand side. So this is the upper left hand region. On the 3D rendering, we've got slightly better bone quality in the upper left molar region. The premolars are intact. Moving to the upper left transaxial view. So this is the region of the sixth. The bone here is again D3, but we've got approximately 10 millimeters of ridge width with 14 millimeters of ridge height. Moving to the second molar region, we again have very adequate bone. This is again D3 quality because very thin cortical plate, 9.9 mm of ridge width with approximately 10 mm of ridge height to the sinus. Again, no sinusitis can be seen, and this area is extremely favorable for implant placement. Alright, so for our kind doctor, we've placed 3 iris implants, iris pollution implants. The 3 implants, this is the upper right implant, the upper left 2 implants are placed right here. On the 3D rendering, you can see that the upper left implants will have adequate bone support all around. The upper right implant has good bone support on the mesial aspect, but definitely will need better bone support on the distal aspect, which can be taken care of if bone augmentation post extraction of the upper right second molar is done. So we will be sharing an implant planning report as well with our doctor so that they can see the virtual implant placement in the most ideal location according to the CBCT scan. So if there are any further questions, please feel free to reach to our team. Thank you very much.